A report by the UN Human Rights Office has found that Israel's pattern of deadly attacks on and around Gaza's hospitals pushed the healthcare system to the brink of collapse with catastrophic effect. The report graphically details the impact of Israel's attacks, from the destruction of buildings and facilities to the killings of patients, staff and other civilians, raising serious concerns about Israel's compliance with international law. The protection of hospitals during warfare is paramount and must be respected by all sides at all times. In essence, if the relentless bombing and the dire humanitarian situation in Gaza were not enough, the one sanctuary where Palestinians should have felt safe, in fact, became a death trap. Under certain circumstances, the deliberate destruction of healthcare facilities may amount to a form of collective punishment, which is also a war crime. The report also highlights that several of these acts, if committed as part of a widespread or systematic attack directed against a civilian population, further to a state or, in the case of non-state actor, organisational policy, may also amount to crimes against humanity. The Palestine Health Ministry has reported that tens of thousands have been injured during the conflict. Many of the injured reportedly died while waiting to be hospitalised or treated. In some of the attacks, the report finds the Israeli military likely used heavy weapons, including 2,000-pound bombs, in densely populated areas. Our office also verified the precision targeting of people inside hospitals. At Al-Orda Hospital in Jabalia, for example, a volunteer nurse was fatally shot in the chest while looking out of a window on the 7th of December 2023.
Out to check, Dennis, would you join me?
Just say copy.
And beyond the conflict itself, civilians were seriously impacted. Women, especially pregnant women, have suffered gravely. Our office received reports that newborns had died because their mothers were unable to attend postnatal checkups or reach medical facilities to give birth. Intentionally directing attacks against hospitals and places where the sick and wounded are treated, provided they are not military objectives, is a war crime. Intentionally directing attacks against the civilian population as such, or against individuals not taking direct part in hostilities, is a war crime. And intentionally disproportionate attacks is also a war crime. There must be independent, thorough and transparent investigations into all of these incidents and full accountability for all violations of international humanitarian law and human rights law which have taken place.